It is a pleasure to welcome everyone today for our event, Reimagining Sustainable Healthcare. And it's absolutely wonderful to see you all with us today. So first, many thanks to our hosts, the UAE Ministry of Health and Prevention, the World Health Organization, Eastern Mediterranean Regional Office, and the Alliance for Transformative Action on Climate and Health, for facilitating these critical and timely discussions. As you know, yesterday was the very first health day at COP. And it was so inspiring to see the $777 million pledged to tackle neglected tropical diseases. This is a major step forward in acknowledging the impact of climate change on people's health. But at the same time, let's not forget the impact of the healthcare industry on climate change. Responsible for an estimated 5% of global carbon emissions, healthcare has a significant role to play to reduce carbon emissions and to fight climate change. Whether it is the laboratories and factories designing and producing the drugs, or the ships and cars that move medical equipment between countries and continents, or the hospitals that treat people, the entire health ecosystem has a huge impact on climate and must reduce its overall footprint. The Alliance for Transformative Action on Climate and Health was founded 2 years ago at COP26 to use the collective power of the World Health Organization's member states to build low-carbon, sustainable, and climate-resilient healthcare systems. Today, we are here to boost attached engagements among critical Eastern Mediterranean region stakeholders. As a region of the world that is already being disproportionately impacted by climate change through changing weather patterns, extreme heat, or drought, it is critical that countries join forces to tackle this shared challenge. This event is not just a platform for discussion. It is a call to action. We are here to listen and learn from attached countries in implementing their sustainability goals. As we delve into our keynotes and panel discussion, we will explore the intricate link between health systems and climate action, emphasizing the urgent need to define policies and strategies tailored to our region's unique challenges and opportunities. We will showcase sustainable healthcare initiatives and best practices that I'm sure will inspire you to take action. Let me introduce quickly myself. I am Nadine Zidani. I'm a purpose-driven entrepreneur and the founder of MENA Impact, a UAE-based company on a mission to build the impact ecosystem in the MENA region. And today I'm thrilled to be your MC and guide throughout the session. As COP28 President said, Dr. Sultan Al-Jaber, this is the time to unite, act, and deliver. And this is why we are all here today. So welcome to our event. Ladies and gentlemen, it is with great honor that we welcome our distinguished keynote speaker, His Excellency Dr. Hussain Abdul Rahman Al-Rand, Assistant Undersecretary for the Public Health Sector at the Ministry of Health and Prevention of the UAE. Dr. Hussain Al-Rand stands at the forefront of healthcare innovation and sustainability in the UAE, embodying the spirit of visionary leadership and commitment to public health. Today, he brings us critical insights from the UAE journey to integrate sustainability in healthcare. His experience and leadership in this arena are inspiring and offer valuable lessons for global health and environmental sustainability. So please join me in warmly welcoming Dr. Hussain Al-Rand.
Bismillah ar-Rahman ar-Rahim. Excellencies, colleagues, ladies and gentlemen, distinguished guests, estimated partner and colleagues, it is a great pleasure to be here with you today. And I extend a warm welcome to all of you in United Arab Emirates in Dubai. Hoping to a pleasant stay, we gather at the crucial crossroad to embark on the transformative journey. Our mission is to lead the way in developing climate resilient and sustainable low carbon health system. This event provides dynamic platform for exchange insights, experiences and innovation ideas focused on understanding the profound impact of climate change on the health. It brings together a diverse range of expertise, knowledge, and experiences. Yesterday, we started the Ever Health Day meeting, and followed by the reaching the last mile with the pledges of, as the MC said, lot of countries who's participated. And we ended by the ministerial meeting. And the ministerial meeting, the declaration was endorsed by more than 128 countries. So this is a moment which we can react and act together. We should unite, act, and perform. Our focus is clear. We will continue to renew the reinforced countries' commitment to the Alliance transformative action on the climate and health. Today we aim highlight three objectives. First, we recognize the continued role of United Arab Emirates in converting global leaders to shape a better future for its people. I'm proud to be standing here in UAE as we facilitate this critical discussion that will lead to the advancement of the climate resilient and sustainable healthcare system. Through this role, we emphasize undeniable link between climate change and health, underlining the need for the seamless integrations of health and climate policies to create a more resilient and sustainable future. Second, we see an opportunity to enhance engagement with attach among key stakeholders in the Middle East and North Africa. This increased engagement is not merely symbolic. It is a call to action and an urgent invitation to enhance knowledge, sharing our experience and country experience, work together to achieve COP26 health program commitment, and also COP27. We are committed to support attach as we work toward these sustainable goals. Recognize that collective effort is essential for success. Third, we acknowledge the need to foster collaboration among nations to facilitate innovation and to light the way toward decarbonization of our health system and healthcare. It is only through collective action that we can achieve the needed change on large scale, enabling us to reach our sustainable healthcare goals and reduce the carbon footprint of our healthcare infrastructure. In this regard, today we will showcase the progress made, key learning, and best practice from across the region in achieving sustainable healthcare goals. These initiatives are not abstract theories, but tangible model actively developed low-carbon health system and prove that positive change is indeed possible. In closing, I would like to express my deepest gratitude to the partner and sponsor who made this event possible. Let us bold and remember that together we have power and sustainable healthcare can be made and make it is really for people, society, and planet. Thank you very much.
Thank you so much, Your Excellency, for this inspiring start to our event. So I forgot to mention that we have translation, English to Arabic and English to French. So if you need that, just raise your hand and someone will come and help you. So, ladies and gentlemen, let's move on to our second keynote. We are honored to welcome Dr. Rana Hajjeh, Director of Program Management at the World Health Organization Eastern Mediterranean Regional Office, a key figure in bridging the gap between climate change and healthcare. Dr. Rana Hajjeh will share insights on sustainable healthcare and the importance of collaborative action from her experience with the Alliance for Transformative Action on Climate and Health, known as ATACH. Her vision emphasizes the urgent need for resilient, low-carbon health systems and a unified approach involving diverse stakeholders for a healthier and sustainable future. Please join me in welcoming Dr. Rana Hajjeh.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. Good morning, colleagues. Sabah al-khair jami'an. I am really delighted to join you here today on the side events. I would very much like to thank our host, Dr. Hussain and the UAE Ministry of Health and Prevention to jointly organize this event with us. Also would like to thank, of course, the Transformative Action on Climate Change and Health, the Sustainable Market Initiatives, SMI, and Global Health Strategies for facilitating this event. I would like to first start by conveying the apologies, sincere apologies from Dr. Ahmed Al-Mandari, our regional director, who couldn't join us today. He has been tied up with the really devastating crisis in Gaza. And he would have really liked to be here as we are discussing sustainability and how to ensure sustainability of healthcare. Our healthcare facilities in Gaza are being destroyed systematically and targeted purposefully. I pray, and let us all pray, that this beautiful event today in this beautiful country with its very strong message for a greener and healthier future will bring peace to our whole region. Let me get to the main topic we are here for, climate change, which is now, I think, has been acknowledged by all as the greatest health challenge of the 21st century. Although the region emits only 8.25% of the world's greenhouse gases, which is basically, we're about less than 10% of the global population. So we are really doing the least in terms of gas emission. Its temperatures and the other climatic hazards are changing twice as fast as in the rest of the world, and so are the health impacts. Climatic hazards are fueling environmental degradation, natural disasters, weather extremes, food and water insecurity, economic disruption, and conflicts, as well as significant displacement of populations. The consequences for health are substantial and include more deadly extreme weather events, increasing cases of non-communicable diseases, increasing emergence and spread of infectious diseases as well. This is already impacting the region's health workforce and infrastructure, our health systems, which have already been weakened by the many emergencies, and it's reducing our capacity to achieve universal health coverage, which is our main goal, health for all. The recent deadly floods in Yemen and Libya in 2023 and in Oman recently, as well as in Pakistan in 2022, are very sad examples of the serious health impacts, where tens of thousands of people were killed, thousands of healthcare facilities were destroyed, leaving millions of people without adequate health services. Your Excellencies, ladies and gentlemen, deep, rapid, and sustained mitigation and an accelerated implementation of adaptation actions would reduce the projected losses and damages for humans as well as for ecosystems and deliver many co-benefits, especially for air quality and health in the region. Any further delay in actions will increase the risks of climate change, undermine decades of improvements in public health, and contravene our collective commitments to the Sustainable Development Goals and the human right to health for all. In order to help the countries of the world in this difficult assignment, WHO, in collaboration with the UNFCCC COP26 and the presidencies, developed the Alliance on Transformative Action on Climate and Health, which has become known as ATTACH. So far, I think more than 80 countries now of the world, including 14 countries in our region, and I think soon there will be 16, I understand, have joined this alliance. We need to work together to support and expand this initiative to help in minimizing the health impacts of climate change. I hope that this event will provide a very dynamic platform for exchanging insights, experiences, innovative ideas on the impacts of climate change on health. The focus is on renewing and reinforcing countries' commitments to ATTACH, driving momentum to achieve sustainable, resilient healthcare systems in the region. Let us work together during the coming 2 hours to first boost engagement with ATTACH among key stakeholders in the Eastern Mediterranean region. We would like to see all 22 member states or countries in our region joining, highlight the UAE's prominent role as a convener for facilitating critical and timely discussions to advance the creation of climate resilient and environmentally sustainable healthcare systems and health systems overall, and showcase sustainable healthcare initiatives and best practices across the region and how they are actively promoting low carbon health systems. I am very inspired being in the UAE as usual, and the United Arab Emirates, which just celebrated its 52nd anniversary. So with inspiration from the United Arab Emirates, let us all unite, act, and deliver, and may God guide us all on the right path to protect our planet and our health from the detrimental impact of climate change. Thank you very much. Have a good day.
Thank you so much, Dr. Rana. Thank you for highlighting the devastating effect of climate change that we already see on our people and the need for urgent collective action. So now we want your attention for a short video from the World Health Organization. So now we will soon begin our first panel focused on the progress towards ATTACH commitments. Since its foundation at COP26 in 2021, the Alliance for Transformative Action on Climate and Health has highlighted the intersection of climate and health in the Eastern Mediterranean region. Despite the initial high-level commitments, progress in this region has been slower than expected. And implementing this commitment has faced numerous challenges. This panel includes health ministers from countries in the region that are signatories of ATTACH, including Egypt, Lebanon, and Tunisia, who will discuss those challenges as well as the achievements to date. So it's a great honor to introduce our panelists. His Excellency Dr. Khaled Abdel Ghaffar, Minister of Health of Egypt. Welcome. His Excellency Dr. Firas Al-Abyadh, Minister of Health of Lebanon. His Excellency Dr. Ali Al-Mrabet, Minister of Health of Tunisia, and Mr. Pascal Soriot, CEO of AstraZeneca. Thank you so much, gentlemen, for joining us today and making the time for this discussion at COP28. So I want to start with Your Excellency, Dr. Abdel Ghaffar, because exactly at the same time last year, all eyes were on Sharm el-Sheikh, because Egypt was hosting COP27. So I really want to ask you, what are the key achievements and initiatives that Egypt has introduced in relation to health and climate, especially that you played a pivotal role in this discussion around health and climate?
Thank you, moderator, and it's really a pleasure to be among this esteemed panelist with my dear colleagues from Lebanon and from Tunisia, and certainly Pascal from AstraZeneca. But allow me at the beginning to highlight the work that we are doing with AstraZeneca, because it's really a success model that we have to elaborate on. I think Egypt was one of the leading countries that considering strengthening resilience of the health system for climate change and related to health impacts. And this involves many public health initiatives that we've been doing, and certainly strengthening the early warning system and trying to develop a very robust emergency response mechanisms. And because of the communication and partnership with different agencies from the private sector, from the NGOs, and certainly from pharmaceutical companies, I think we've done a great job in terms of communication. And I have to highlight here what we call the 100 Million Lives Presidential Initiative, where we managed to screen more than 60, 70 million of Egyptian population in different aspects. And certainly one of the success models was for hepatitis C, where Egypt has just been announced by the WHO to receive the golden tier to be eradicated from virus C, and that's a great achievement that we've done that also with the WHO, with the pharmaceutical companies related, and certainly with other partners. So in that sense, I would like also to highlight the importance of the partnership with the Egyptian government adopted with other companies like AstraZeneca, who have supported us in different initiatives in that respect. So I think this has to be mentioned. Going back to your question, I think when you talk about initiatives that has been adopted since Egypt hosted the last presidential COP27 in Sharm el-Sheikh, we've done a lot of achievements since that time. I will just mention some of them. The first one is the initiative on climate change and nutrition, which we call it ICAN. And this initiative will help the fostering the collaboration to accelerate transformative action towards integrating climate action and one important aspect, which is nutrition. And I think nobody talks a lot about this important relation. And if you talk about in Egypt with overpopulation, now more than 105 million, and having also around 9 million immigrants and refugees, where we like to call them guests of Egypt. And that's a big burden when it comes to nutrition and food security. And Egypt is considered one of the vulnerable countries as regards to climate change affections, because of the raise of the sea level that was expected to be like around 68 centimeter by 2050, and that maybe subject cities like Alexandria and Nile Delta to floods, as you mentioned, floods in Libya and in Yemen and in Pakistan, and this is countries of related to the to our Eastern Mediterranean regions. So we are vulnerable in terms of climate impact. And certainly this has a lot to do with action with the health when you talk about the food security and nutrition because of the affection of desertification or even losing a lot of irrigated lands and food and water scarcity. So that's why we in Egypt we started to adopt our national food and nutrition strategy and certainly put the ICANN with the attach on top of our priority for that purpose. And that will definitely improve the nutrition status of the population and will address the food security, particularly in the vulnerable group in different Egyptian governorates. Second, the Green Hospital Initiative, which we also adopted with our friends and partners from Ghaffar to put like green standards for hospital accreditation. Whenever we are going to build a new hospital or even accredit any hospital, it has to go with the green standard. And I think this is an initiative that needs to be respected when it comes to the healthcare sector and try to facilitate, as you mentioned, that sometimes the health facilities also impact on the climate change. So that's why we need to start by ourselves, by having our green hospitals and facilitate environmentally friendly, energy efficient buildings and reducing the carbon footprint of hospitals. Third, also Egypt launched what we call the Green Bond. And this revenues expected from green bonds will be used to finance green projects. Not just green projects for the transport sector or for the renewable energy sector, but certainly for also the health sector. So this green bonds is quite innovative to start to attract all international organizations to support in order to facilitate the renewable energy and feel green hospitals. Last but not least, the One Health initiative. We also adopted the One Health initiative with a holistic approach to significantly address the climate change and its interconnected relation, not just for humans, but definitely for animals, planets, and different environments. So these are just initiatives that we managed to work since the Sharm el-Sheikh from last year to now, and hopefully with our friends and partners we can even adopt more initiatives in the future. I'll stop here. Thank you.
Thank you. That's a major achievement, and thank you for mentioning the partnership between private and public and the power it can bring to a country like Egypt. Moving on to Your Excellency, Dr. Firas Al-Abyadh. So in light of Lebanon's commitments to the attached ambitions, could you elaborate on the steps and strategies that Lebanon is implementing to foster resilient and sustainable healthcare systems?
So thank you, and I would like to thank UAE for hosting COP28. Clearly going to be a very successful COP. Now, last year, Lebanon recorded its first cholera outbreak in 3 decades. If you look at what happened, you see that it started in different parts of Asia. Then we saw a progression from Yemen to Iraq to Syria and then to Lebanon. The main reason for that outbreak were fragility in the water and sanitation infrastructure. And if you look at these countries that have been part of a conflict and displacement, you see that there is the fragility of their infrastructure and inability to deal with this mass displacement. As you know, Lebanon, a country of 4 million, is hosting almost 2 million refugees from neighboring country. And that puts a lot of burden on our infrastructure. Now, health systems are very important when we are talking about a country response. And unfortunately, what we are seeing in our region is a lot of conflict, a lot of displacement. In addition to that, we see direct effects of climate change, whether related to availability of water, deforestation, or others. If you look at the countries that I've just mentioned, Lebanon, Syria, and Iraq. These are countries that are well known to have major water sources, Dajla, Al-Furat, Litani, other rivers. But despite that, you see that there is a lot of issues related to the availability of clean water. And climate change does not only directly affect health, as we've been hearing. There are also indirect effects, because as you have more of these social tensions, this will eventually affect the determinants of health, and indirectly mean that there are more illnesses, more diseases that health system have to deal with. Now, Lebanon was able to quickly contain the cholera outbreak because of our existing early warning systems and response. But we saw that Kuwait recorded 2 or 3 cases, I think, and also Jordan had to put a lot of effort at the borders to be able to contain the spread. And in a region where we have high mobility and porous borders, you could see how a health issue in one country can easily then move into other countries as well. Can these countries, such as Lebanon, who have low resources, actually invest in climate change and health? Now, sometimes investments, when you are talking about low resources, is asking, for example, a hungry person to become even more hungry today so that he won't be hungry in 5 or 7 days' time. It's extremely difficult for these investments to occur. And without these investments, the situation obviously will become worse. Now, Lebanon has been proactive. The Ministry of Public Health has been proactive in dealing with climate change and health. I would like to mention 2 important issues that we did. First, last year, we launched our national strategy for renewable energy in healthcare facilities. We've implemented a large part of that. Up till now, 50% of our public hospitals have been solarized, and over 70% of our primary healthcare centers have also been solarized, and we are progressing in that agenda. Another area which is extremely important was collaboration between academia, local, and international in creating a geo-health hub. This is a center that conducts research and data collection and advises policymakers on and provide local data. Now, this is extremely important because a lot of the time we talk about global data, but here we're talking about local data to allow policymakers to really make decisions that are informed and properly allocate resources in a low resource environment. And finally, I think what is extremely important, and here, let me be a bit undiplomatic. I think that, we come to COP28. The region has been very active, especially that the region has hosted the last 2 COPs, 27 and 28, in pushing for this agenda. And it is a very important agenda. We see the global repercussions of that agenda. But here also we need to think regionally, because at the end of the day, with adaptation tends to be local. Countries adapt, and health systems within countries adapt. But as COVID has taught us, if we don't do proper strengthening of local systems, then the problems become regional. And here I think we are calling for more regional cooperation. I think the fact that our region, EMRO, was one of the first regions to launch a strategy, an environment, climate, and health strategy is extremely important. I think the efforts that are being put regionally are important, and this is something that we would like to see more in the future. Thank you.
Thank you so much. Thank you so much for highlighting the challenges, and despite those challenges, still taking action to transform the healthcare system. And you mentioned something really important is data. We absolutely need data from the region if we want to take action, and that's something we're gonna dive in the next panel. Thank you so much. Moving on to Your Excellency, Dr. Ali Al-Mrabet. Could you please outline the key strategies Tunisia has implemented to monitor and enhance the resilience of its health systems against climate change? And if you can, in your answer as well, highlight the role of international partnerships in these efforts.
Thank you for your question. Honorable guests, dear colleagues, good morning. I will speak by switching English and Arabic.
Yes.
السلام عليكم ورحمة الله وبركاته. تهانينا الحارة بالعيد الإمارات الشقيق. وكل عام والإمارات وتونس والعالم بخير. Ladies and gentlemen, in Tunisia we are actually aware of the health impacts of climate change, being among the Mediterranean region most susceptible to climatic change. Recognizing this, our health sector's response has been comprehensive and proactive. A cornerstone of our approach is our active participation in the Alliance for Transformative Action on Climate and Health, facilitating regional and national strategy integration and continual knowledge sharing. In 2002, non-communicable disease accounted for more than 79.7% of deaths and 70.8% of this burden in Tunisia. And we are working to strengthen systems for early detection and treatment of non-communicable disease, as well as palliative care, an essential part of the response to this category of disease which can be affected by climate change. At the beginning of the COVID pandemic in Tunisia, the government supported the health sector with additional funds from the World Bank Group to help strengthen the resilience of health system and reinforce healthcare capacities to reduce the burden of COVID-19 and future health shocks by supporting social and economic measures. وهنا تجدر الإشارة. I switch in Arabic. وهنا تجدر الإشارة إلى استراتيجيتنا الوطنية الصحية للصحة تونس 2035 والتي نعمل على تطويرها لتركز على تحسين الأداء العام لنظامنا الصحي مع التأكيد المباشر على تكامل السياسات الصحية والمناخية في بلادنا، ويشمل ذلك تعزيز قدراتنا في مجال التطعيم والفحص وإدارة الأمراض المزمنة لتوفير الاحتياجات الصحية اللازمة لأبناء شعبنا في تونس. إذ تتوافق هذه الاستراتيجية مع استراتيجياتنا الوطنية للحياد الكربوني ومقاومة التغيرات المناخية حتى عام 2050، مما يبرز التزامنا بالممارسات الصحية المستدامة. وفي سياق العمل الدؤوب حرصنا على تنفيذ منهجية التكيف التدريجي حتى عام 2030 لإدارة المشاكل الصحية المتعلقة بالمناخ بطريقة فعالة وشاملة. ستنتقل هذه الاستراتيجية إلى منهج التكيف الشامل للتغيرات المناخية بعد عام 2030 مع التركيز المستمر على الوقاية والمراقبة الاستباقية لمخاطر الصحة المرتبطة بتغير المناخ، ويشمل ذلك بناء قدرات مقدمي الرعاية الصحية وتعزيز خارطة عملنا في مجال الصحة في تونس لتشمل العوامل المناخية المؤثرة على صحة المواطنين. وهنا لابد من الإشارة إلى الدور المميز الذي يلعبه تعاوننا مع شركاء الدوليين ولا سيما اليونيسف في تعزيز سلسلة التبريد الخاصة بالتطعيمات مع تحسين البنى التحتية لمراكزنا للرعاية الصحية لتكون صامدة للتغيرات المناخية. كما يعتبر التعاون بين القطاع العام والقطاع الخاص عاملا أساسيا أدى إلى تطور محددات الصحة، وذلك من خلال الدعم البنى التحتية الصحية والمستشفيات، وخاصة فيما يتعلق بإدارة النفايات الخطرة ونفايات العلاج والنفايات المنزلية. وبصدد الحوكمة المناخية أنشأنا لجنة قطاعية تحت إشراف وزارة الصحة للتركيز على جوانب حاسمة مثل التخطيط لموجات الحر واقتصاد الموارد المائية واليقظة الصحية، وذلك للتحكم في النواقل وإعداد مخططات للمحافظة على نوعية الهواء، وذلك بالتعاون مع وزارة البيئة. وكل هذا يعكس مشاركتنا النشطة في تعجيل التقدم نحو المساهمات المحددة على المستوى الوطني، حيث تم توثيق مساهمتنا الوطنية المحددة للمجال الصحي في الجلسة 26 للمناخ لمؤتمر المناخ كوب 26، مما يعكس تفانينا في الالتزامات المناخية العالمية. Currently, we are developing a health national adoption plan focusing on the vulnerability of our health system to climate change. This includes addressing disparities in water access and healthcare provisions, particularly in rural areas, and ensuring the resilience of our healthcare infrastructure to natural disaster. To conclude, Tunisia's approach to climate change and health is holistic, integrating national strategies, international collaboration, and robust governance to create a resilient, sustainable health system. Thank you very much.
Thank you so much, Your Excellency. Moving on to Mr. Pascal Soriot. You are the CEO of AstraZeneca, but you're not here as a CEO of AstraZeneca, but more as a convener of the Sustainable Markets Initiative Health Systems Task Force. Can you share the progress that has been made since its inception at COP26, and especially in partnership with ATACH, and the impact this joint efforts on accelerating the delivery of net zero healthcare?
Yeah, with pleasure. First of all, let me say it's really a great pleasure to be here today. Does it work? Yeah, cool. Let me say it's really a great pleasure to be here today and share this be on this panel. I think it's important, before I comment on SMI, it's important to remember the scale of the issue. COVID killed 7 million people, but climate change and pollution killed more than 7 million people every year. And if the temperature increases by 2 degrees, which is more than the 1.5 degree targeted as part of the Paris Agreement, so if it increases by 2 degrees, the number of deaths will increase by 370%, so almost 4 times more. So you can think about 30 million people every year dying of climate change and pollution. And it's important to remember that in the end, we all breathe the same air globally, because it is tempting in some richer country to think it's affecting other parts of the world. It's not affecting us in Europe or in the United States. It's affecting other countries, not us. It's affecting everybody. It's been very, very well established, and there was a publication in Nature earlier this year showing clearly the small particles in the air are what is driving lung cancer, chronic bronchitis. We know heat is driving stroke, cardiovascular events. People die, and they die everywhere around the world. So we actually, one of the things we have to make sure is that we make everybody around the world realize it's affecting us all. I think it's really a critical message. And at the end of the day, you know, the healthcare system is in a strange position, right? Because our role collectively is to help people stay healthy or cure them if they are sick. But in reality, we're also hurting them by producing carbon. You said it a bit earlier, on average, the healthcare system produces 5% of carbon emissions globally. In more developed countries like the United States, it's more than 8%. So it's enormous, much more than the airline industry. So the question is, what can we do about it? And there are two big buckets of carbon production, if you will. One is the supply chain. And of course, pharmaceutical companies are part of this supply chain with others. And the second bucket is delivery of care, which is mostly hospital. And it's about 50% and 50%. So you have to tackle both aspects to reduce carbon across the entire journey a patient will go through if they're unwell. So on the supplier side, what we are doing is working through the SMI, and I'll say a few words about SMI in a minute, to reduce our carbon emissions. And one of the messages is absolutely feasible. As a company, AstraZeneca, since 2015, our company has doubled in size, but our carbon emissions have reduced by 60%. Our water consumption is reduced by 20%. Our waste production is reduced by 20%. But it's not enough. We want to go beyond this. By 2026, we want our carbon to be carbon zero for our scope 1 and 2, and we're very much on track to do this. By 2030, we want to reduce our scope 3 carbon emissions by 50%. And we want to be carbon zero totally across the supply, the scope 1, 2, and 3 by 2045. We are investing $2 billion in this transition, and I suspect when we are finished, it will be more than $2 billion. For instance, we're investing $400 million in removing the propellant or replacing the propellant in our inhalers, products that are used for asthma, COPD. We're investing $400 million in developing a new propellant that will be carbon-free. We are actually building partnerships around the world, and I think it was mentioned before, partnerships between public and private are really critical. Also partnership between private and private. And so, for instance, we're partnering with Vanguard Renewable in the United States to build biogas fermenters. And we are shifting completely the supply of gas to our plants in the United States. We're moving to biogas, and we go beyond this. Biogas is essentially you take food waste, you take farming waste, you put it together, and you let it ferment. If you didn't do this, it would ferment by itself and free methane in the atmosphere, and methane is 100 times more warming than carbon. So you want to capture this, and then capture the methane and modify it into gas we can use in our plants. And our team is basically made of experts that are experts in fermentation because we manufacture antibodies all the time. So now our team is working on this fermentation process to make it even more efficient. So biogas can become a lot more price competitive, and others in other industries can use it in the US. We do the same in the UK. We do the same in China and some parts of China. Another example is we are building wind farms with other industries in Sweden, where we have a big presence, in China also, where we have a big presence. And so we are shifting our energy supply to our manufacturing sites and our buildings to renewable energy. And we do this across the board. In Japan, we are 100% renewable already for all our buildings. We're shifting our fleet of cars around the world to electrical vehicles. We're almost at 30% shift to EV cars already. Some countries like the Netherlands, we're already 100% EV, and we want to be 100% EV by 2026. So those are some of the things we do as a company, and other companies are doing the same. And I think the message is it is feasible. So beyond that, what we do is, with the SMI, is work together with other companies in our industry, but also we have the NHS in our group, we have WHO representation, we have the UNICEF, we have academic institutions. This group was launched by King Charles when he was still Prince of Wales, and his leadership in this area has been remarkable. It's really helped us create attention, create momentum, attract other companies and public institutions, and we work together, public and private, with one single goal, which is how do we reduce carbon. So by working together, for instance, we are now introducing a program in India and in China where we are going to produce green energy, and we are going to offer this green energy at competitive cost to our suppliers. Because the big issue, of course, for any company is your scope 3, your suppliers. So how do you help? I mean, how do you tell your suppliers they have to be renewable, but also how do you help them? So as a group of companies, we've established standards. We've sent those standards to our suppliers. We've told them you have to have goals, and you have to move to renewable energy and be green by as per your goals. But we also will help you. And those standards are key, because if AstraZeneca tell our suppliers, we want you to be green, they may decide it's too expensive, we don't want to do it for one customer. But if the entire industry tells the suppliers, here are the standards, then they have no choice. But on top of it, we help them. And so in India and China, for instance, this collaborative project will generate 70 megawatt of green energy, which is the equivalent of taking 25,000 cars off the road. And that is what the SMI is helping us deliver overall. So beyond that, we're also tackling the second part. So that's the first part, which is supply chain. The second part is the hospital. And the number one thing you've got to do is stop people from being hospitalized. That's obvious, because when they are in the hospital, it's not good for them. They cost money, but they also produce a lot of carbon. So now, what you have to do there is really run screening, diagnosis campaigns, so you can treat people early. So take kidney disease, especially in this part of the world, there is a lot of kidney disease. So we are running campaigns to diagnose people early and stop them from moving into severe kidney disease. If they move into dialysis, their carbon production is multiplied. And of course, it's not good for them. Lung cancer, how do we diagnose lung cancer early so we can cure people? If you diagnose it too late, which is the case today in many cases, people are metastatic. They're going to live longer if they get the right treatment. But the unfortunate part is they will still die. And in the meantime, they'll be in hospital a long time. It will be bad for them, and they will also produce carbon. So diagnose this disease early, whether it's chronic bronchitis, kidney disease, cancer, or any other thing, is one of the things that we work on, is putting together, working together with governments to introduce policies. We've done this in Japan and the European Union. Policies to diagnose people early and cure them. Another thing we do is look at digital technologies, so we can actually use digital tools to run our clinical trials, reduce the carbon production. So we can introduce digital tools in how patients are treated. Interactions with doctors through digital tools reduces traveling and carbon production. We're looking at, now we're looking at potentially developing a curriculum for medical students, because doctors, young doctors, are very interested, but it's not part of the medical courses. So how do you help them become more aware of how can I be green in the hospital, because they don't even know. So we are looking at this, and we are working together with a group in the United States that is led by Dr. Zhao, who is the president of the US National Academy of Medicine, and is really working on some of those aspects. We're working with NHS to do this. We have launched a chapter of the SMI in China a couple of weeks ago, so that we can actually do the same in China, bringing companies together. So those are some of the things we do, and of course we are collaborating with Attach to implement similar policy. But I think the key messages are, it affects us all. And we really be careful, because often people say, well, there's inequity, it's unfair, it's affecting poor countries, and it's true. But it is too easy then for people in the richer countries to say, well, it's not affecting me. We need to create this sense of urgency that everybody around the world thinks, this is important, it's affecting me too, I have to do something about it. That's one message, it's affecting us all. The second message is, it's possible, it's feasible, it can be done. And it can be done without bankrupting your company or your institution. It takes time, you have to do it over time. But if you do it over time and progressively, it's possible. And the final message is partnerships, public-private partnerships, I think are critical so we can make it happen together.
Thank you so much. Thanks for reminding us that it's affecting us all and showing us the power of partnership to transform the supply chain with SMI. So now we have Your Excellency Dr. Firas Ibrahim Al-Hawari, Minister of Health in Jordan, that is joining us. Please welcome on stage.
السلام عليكم. سلم على الزملاء. Thank you.
Thank you so much for joining us.
Thank you.
So, Your Excellency, Jordan has a national target to reach net zero by 2050. So how do sustainable healthcare goals fit into this picture and contribute to this national goal?
Thank you so much for the question, and thank you for the invitation to be here with you. Let me start first by a general comment. It took 27 meetings before health finally reaching COP. And I think this is a golden opportunity because we all witnessed how the world got together during the COVID crisis and got it under control within few years. We're talking about three years. The world didn't get together until the world realized that lives cannot be saved unless we are all safe. And I think the addition of health to COP will highlight this piece of information. So now we're not just talking about the economy, but we are balancing the economy versus health, or economy and health, to be honest. And we're seeing the impact we started seeing the impact of the extreme change in weathers, extreme change in temperatures, floods, natural disasters, and soon we will see also new surging infections because of that. So I think, talking in general about the goals and the commitments of Jordan. Jordan has definitely shown commitment towards all the initiatives, whether it's the Paris Accord, whether it's the Attach initiative. And we are working both on both sides, the green growth, basically, how we can improve our hospitals, how we can reduce waste, and we're doing that through innovative ways of getting rid of wastes. We are putting renewable energy in every single spot that we can do, and we're doing it fast. And at the same time, we're putting plans to train our staff on that. And again, we need to look at health as not just a producer of carbon emission, but also being influenced by this hypothesis. So Jordan, most importantly, has put a strategy. It's going to be a 10-year strategy. In that strategy, we outline all the building blocks that we need in order to do and maintain that balance.
Thank you so much. So before we end this session, so you highlighted, all of you, a lot of challenges that you're facing in your countries and the need for more action. So I want to ask you in 1 minute maximum, if you can share with us what's the main takeaway from you, from this session, and what we must do next to make progress towards the attached commitments.
I think for me, awareness and budgeting and financing of the health system to be more resilient is a great challenge that I'm sure that it's not just for Egypt, but for all of us. Finance is a great issue, and the international community and the funding agencies has to look at this point very, very much, especially in countries highly affected by that was told to be more adaptive, and that considered, I think, is a major issue as it regards to the challenge. Thank you.
Thank you.
I think there are two main messages. If the climate change and health is important for the international community and developed countries, for countries with fragile health systems, it is critical, because a lot of those countries are just one step away from complete collapse of their health systems. And therefore, this issue is of paramount importance for these health systems. Adaptation is something they have to do now, and it cannot wait. Now, the other problem then, and this is back to what His Excellency was saying, is we do have a resource problem. A lot of the resources that we have are mainly directed towards humanitarian action, and there isn't enough resources that are allocated for looking at the medium to long term. And we need financing solutions. Now, whether those financing solutions are partnerships, whether it is the industry, whether it is international organizations, whether it's innovative financing, looking at green bonds or others. But at the end of the day, without financing, these countries that are showing commitment cannot deliver. And if they cannot deliver, and this is a final lesson that we learned from COVID, health cannot be put into borders. If we have a problem in health, borders cannot stop that problem, and that problem will become global eventually.
Thank you.
شكرا. أبقى في نفس سياق ما قاله زملائي معالي الوزراء، وقد علمتنا جائحة الكوفيد وحققت أن العالم قرية كبيرة بدون حدود، وتبقى التغيرات المناخية لكافة أنحاء العالم وليست لها حدود. فلنعمل جميعا معا للحد من أسباب التغيرات المناخية، ولنعمل معا اليد في اليد كافة الدول وكافة الشعوب لحلحلة هذا الموضوع والمجهود الكامل للصحة لكافة مواطنينا في القارة وفي العالم أجمع.
Thank you.
Well, I think the most important message that I would like to send is I would like to call upon all leaders in health in the world. It's time for us to think about this as an emergency. We in the healthcare field, we are good at preempting and planning for severe and extreme conditions. We don't want to wait to see the effect and the impact of climate change. I think right now, building resilient health systems, think about the worst so that it doesn't happen. I don't mean to be pessimistic, but in fact, this is how we prepare in medicine. We take the precautions in order to get away with minimum losses. We are seeing the signals and the signs, and we need to move now. And I would like also to highlight one thing. For countries who continuously suffer the impact of political situations, refugees in particular, those countries are at higher risk of the impact of these refugees, and it is extremely difficult to plan for their healthcare systems, and they are extremely vulnerable for such conditions. So I think we need a message also to ensure that such countries are being taken care of, because we don't want their systems to collapse because of the extra pressure. Thank you.
Thank you.
Well, actually, COVID showed us the importance of having a good healthcare system. If you don't have a good healthcare system, your economy collapses. And if your economy collapses, your healthcare system gets even worse. So really, I think there is urgency to address this issue. So that's one message. The second is, as I said earlier, it's affecting us all. And again, going back to collaboration between private and public, but also between countries. So the richer countries actually can put together financing systems that will enable the rest of the world to adapt and modify the healthcare systems around the world. So it's really about urgency, awareness of the issue, and collaboration.
Thank you so much. And we can feel the urgency to take action from your insights today. That's very clear, and it's a fantastic forum to send this message. So thank you so much. Thank you for your time. And let's stand up for a quick photo before we wrap up this panel. Thank you so much.